Begin with the conversation tonight with the Deputy Minister of Health. Health Minister Dr. Phaahla has said that government aims to vaccinate 70% of the adult population by December 16th, 2021. This is a minimum of 28 million adults. Well, to date, 15.3% of the 18-plus cohort has been vaccinated fully. And, of course, that means 10.5% of the population of South Africa. The Deputy Minister, Dr. Sibongiseni joins us now to discuss this and more. You can be a part of this conversation by sending us your WhatsApp questions and your comments tonight on 072-110-5584, or you can tweet us at Newzroom 405. Deputy Minister, good evening, and thank you very much for your time and joining us tonight here on In Focus. If you look at those numbers, and I'm sure you're well familiar with them, the latest indicating 15.3% of 18-plus South Africans being fully vaccinated, and only 10.2% of the population in essence. And Limpopo leading there with about 20% of that adult population vaccinated, the Eastern Cape at 19%, the Western Cape at 17%. Mpumalanga not doing very well, trailing behind at only 9.6%. Earlier in the month, you had indicated that you're not happy with the momentum of the rollout. Where are you sitting today?
No, thank you very much, Mr. Mzuli, and to your viewers. The minister has actually requested certain experts to prepare for him what we call a mathematical model to say, if by end of this year we want to be at the herd immunity, 70% vaccinated population, what should it take for us to do? Now, they've worked out those mathematical models and therefore dished out to all provinces to say, as Gauteng, this is what is expected from the population. This is expected Western Cape. So all provinces, we are therefore working towards a particular target. And that is why, therefore, we are able to detect and lag behind and notice where there's a lag in a particular province. But you would realize, Mr. Mzuli, that all provinces are really doing their best. And the presentation that they made to us yesterday was showcasing where are they doing well and where are they not doing well, up to a level of a sub-district. You can now tell, not just saying Tshwane Metro, but which part of Tshwane is doing well and which one is not doing well. So we are monitoring up to that level. And therefore, we are putting in strategies to actually improve all that. As you probably recall, maybe you'll be noticing the Deputy President tomorrow leading a delegation of ministers focusing on these provinces that we think are lagging behind. Gauteng is one of them, because while they have done well in Gauteng, but the population that they have is so vast that they should do a bit more. Mpumalanga and Northwest, those are the provinces, the three of them that are lagging behind. Yes, we should focus on all of them, and those that are doing relatively well should also be continuing. What we are doing, Mr. Mzuli, are multi-pronged strategies. One, going into malls, having drive-thrus, going to pension pay points, approaching the traditional leadership and religious leadership. You're right, you quoted Limpopo. One of the things that made Limpopo to do that well, being a rural province, was that bold step taken by the MEC in that province, visiting the two bishops of the very big churches there and getting them vaccinating in public, and therefore most of their followers and members have since vaccinated. So all those strategies we are putting together. Yeah. And right now, and on Monday, I was invited by the MEC for Free State. We visited Free State, and we were observing the Cheetahs Rugby Club actually taking the vaccine. Now, that is what we are planning. Because Mr. Mzuli, if you were to ask me, as some other journalists have asked the minister, what type of a 2022 we would like to have? The minister is saying, look, it depends on all of us putting together this collective plan. Yeah. Whether we have a Christmas that is free, whether we have an Easter that is also going to open up, it depends on all of us. We are now taking a vaccine to the population.
Speaking of health MEC in Limpopo, Dr. Popira Machuba, she spoke to us here on the show about 2 days ago, and she says part of what she is now thinking about in that province, particularly to deal with vaccine hesitancy, considering, of course, that the less vaccine coverage we have in the country, the more chances of the virus getting scoped to mutate. We are now talking of the C12 variant, which is a variant of interest, maybe not yet of concern. But she is suggesting that part of the vaccine options should include the private sector using, for example, rights of acceptance to be reserved to people who can prove and show that they are vaccinated. I know the minister has said maybe it's time that we open this debate and this discussion around vaccine passports. What is preventing us from taking more coercive strategies when it comes to getting people vaccinated?
Yeah, no, Mr. Mduli, let's not get to that one. The MEC for Limpopo has put a view. Let's all participate into it. But as a collective, under the leadership of Minister Phaahla, we are looking into that. And when we have actually canvassed enough views and we have taken it to that level, we will, I'm sure the minister will bring it to the fore and to the public as to what is our collective view on that one.
All right. When is Sputnik V and other related vaccines joining the rollout campaign in South Africa?
While we are not really complaining, because, you know, if you 3-4 months ago, we were actually running around looking for vaccines. Now we have enough J&J and Pfizer. You are correct. We met 3 days ago with the leadership of SAPRA, and I know the minister today was also having a meeting. We are continuously saying, when are you getting these vaccines up and running? It's not because we are short of vaccines, but it's just that everybody must also throw their dice into the market space. Now, we are informed because they have to go through a rigorous process of a regulatory checkup by SAPRA, that they are at a very advanced level of being passed through. We can only become a client of that on this Sputnik COVID vaccine rollout based on them having passed and registered by SAPRA. So the process is still at the SAPRA level of registration, sir.
Yeah, and part of course, what people are asking is why is that process not taking priority, at least being sped up so that people can have more option? And would that not be part of the strategies that would, I guess, get more people to get vaccinated? For example, if you look at the figures, when you look at the Pfizer vaccine, South African adults who have taken one jab, 16.4%, and 7.9% of the Pfizer, if you look at those who are fully vaccinated. Meanwhile, the Johnson and Johnson sitting at about 7.1%. So it tells you that people maybe have other preferences to other vaccines, and the more options you have, a cocktail of vaccines, maybe people will have a lesser difficulty getting vaccinated because at least they have more options to choose from.
Yes, that would be a logical and a reasonable statement to make. However, I think what SAPRA is doing is to fulfill all the criteria and all the basic requirements that they have before them to say, that's probably related to this reason, Mr. Mdulu, why sometimes I would invent a particular medicinal plant from the African traditional medicine and take forever to it get registered, because there's a rigorous process of actually having to fulfill a criteria that has to be set there. So that is something that within SAPRA, but I'm saying the minister is not engaging with them, because you are right, the more the merrier, but we will have to actually get them well processed, get them their safety and efficacy well pronounced before they can be out there in the market.
Right. Now, I know you're saying you've got this mathematical model that you are now interrogating a little bit further so that it can tell you exactly what's happening at district level as far as vaccine hesitancy and the uptake of vaccines. At what point are you going to be saying the December target of 70% is not feasible?
No. The mathematical model, Mr. Mluli, is already there. It now is a target that has been dished out to all provinces. We are all working out to a particular target. For instance, overall, the minister is saying if every day we vaccinate between 270,000 to 200,000, we'll be doing fairly well. Now, everybody make that contribution. So if it's only when we're doing 210 or less that we'll then have to be checking out who is not pulling it. So the projection and the mathematical model has told us that if you sit at this bracket per day, per week, 5 days a week, or those who are doing 7 days, then you're able to meet the target. So we are working towards that, and we are able to check and monitor who is not pulling the weight and what are the challenges, and therefore we go and focus on that and pull up. That's why we are even opening up in the taxi ranks, because if you want Mr. Mdluli, who comes in at 6 o'clock at work to go to the nearest clinic for vaccination, he or she will not be able to get there. So you go and catch them at the taxi ranks, at the drive-thrus, at the workplace, and be making sure that it is the vaccine that is taken to the people, rather than expecting people to really move and look around and find where are the vaccines.
Yeah. What other incentives, except, of course, accessibility and easy access would be one of the things. If I can get vaccinated without an inconvenience of having to wait for 3 hours, it would be great. But what other incentives are you putting out there, particularly for the audience that is not really vaccine hesitant, but they have absolute apathy? They are not even remotely thinking about vaccines on their minds right now because they don't think they are at risk.
Okay, Mr. Mluli, let me not steal the thunder of the minister, because there's a work in progress of that. What incentives are we putting in place? And within a week, I'm sure the minister will be ready and available to make those pronouncements. It's something that we are looking into, supporting the religious sector, like the sporting. Look, what is actually there, we have to agree that what we see in Europe, what we see in US, where people can fill stadium playing, it is not the effort of government alone. It's an effort of all of us. And those fans that are there are vaccinated. And therefore, it could be an incentive to say, you want to improve this attendance in this area, in this gathering, in this church, in the stadium, we will expect you to do 1, 2, 3, 4. So there is a progress that the minister is working out with the other ministers on that part. And maybe let me leave it at that for now, because the minister will probably be ready to give us an update in the next week or two.
We don't want to steal the minister's thunder, but it will be just sufficient for us if you can just indicate to us that what you are telling us is that the minister is currently contemplating more incentives to get people to get their jabs.
Absolutely. It's been a request that is coming in from various sectors, and the minister is looking and consulting on that part, and he'll probably be coming back to give us an update as to where he is on that part.
Deputy Health Minister there, Dr. Sibongiseni Dhlomo, staying with us. Welcome back live with us tonight on In Focus, Newzroom Afrika, channel 405, in conversation tonight with the Deputy Health Minister, Dr. Sibongiseni Dhlomo. And we are, of course, talking about the rollout of vaccines in the country and some of the challenges and strategies, as well as ways they can adopt to get more people getting those jabs in arms. 67%, 62%, 52% if you're looking at other countries and what they're doing right now. And of course, we are talking a time when the African continent was experiencing a scarcity of vaccines. However, now that they are readily available, what are the challenges still in getting those jabs in arms? There has been a number, Dr. Dhlomo, of vaccine centers that have been actually sitting empty. In fact, those officials, they're saying we pretty much sit the whole day without even seeing a single person. What's the strategy to get those maybe even filled up or becoming mobile?
There was a plan for supporting at least the 3 provinces as a start, Gauteng, where we actually are providing, because we don't know whether purpose is related to challenges of transport. That's why we're saying taking vaccines to where people are. That in Gauteng, particularly Tshwane and Johannesburg, and around Durban and in Gqeberha, we started last year providing transport for the senior citizens to be taken into bigger, here in Gauteng, in Galaga Estate, and in KZN, it was in Konobia, Mhlanga, where we are taking to and fro our senior citizens, was that could actually be another impeding factor to actually go to those sites. The other ones, to say other people are really, like young people, are having a lot of time to themselves. They just don't want to wait there. In fact, they're saying, there's been tweets and other information says, I don't want to come and wait there for long. So they come in their drive-thrus, and we can do 3 or 4 in one car in all the jabs, and they're out within 10 minutes. And the one was down there in some of the broadcasting rooms where we had some of those drive-thru, and we are just going all over. You walk around in the malls, you see an area, go there, go and get a jab quickly within 5 minutes, then you can continue your shopping. So we are doing all that, speaking to other, and we are saying, since we opened for the 18 up to 34, that is a group of South Africans who are stars in their own right, who are people of, who are actually, people can actually bring in, they have a lot of fans in terms of what they're doing, either as artists or as actually sports stars, and therefore, if they could also support us once they are vaccinated, indicate, like I did say in the Free State, we had the cheetahs actually taking the vaccine openly. If that could be rolled out in the whole country, in all sporting codes, then you can find a lot of the fans coming forward, and also I would like to. But you are right, we are actually saying now, rather let's not have vaccination sites in most remote areas, but let us bring them closer to where people are, where people can just walk and not have to take 2 or 3 buses or taxis to the vaccination sites.
I think that is probably a correct approach, and maybe one that you should pursue a little bit more. Marketers, when they talk about this question of vaccine hesitancy or apathy, they say people would receive the news more if the vehicle was somebody that they trusted. Now, I'm not sure whether politicians are the right vehicle as far as the trust that they have in communities to be the one who are pushing the vaccine campaign.
You are correct. Like I come from a rural area. When our chief has spoken, we don't cross that line. So we also, if we have the vaccine taken up by the chiefs, AMACOS in all areas, and people are respected and then taken seriously by the community, it goes a long way. Like I was indicating in Limpopo, also our faith-based organizations, leaders in there, if my preacher has spoken positively, has taken the vaccine, most of the congregants in that space will also follow. So those are influencers in the society, the influencers for young people also, that's what I'm referring to. So we are also saying, let's probably not get only the politicians, but the councillors are well respected. They must also indicate members of parliament, members of provincial legislatures, MECs, premiers, if they're all, and some of them have done it openly, that is also going to socially mobilize all of us to go this way. And again, you speak to any teacher, you speak to a nurse. Few months ago, before this vaccine rollout was done, we still were losing quite a lot of our nurses, our healthcare professionals. Right now, the number is insignificantly low, and it does give you a sort of evidence that it works. Teachers now are no more dying in big numbers because they've been vaccinated. Why? Because we now know that if you are vaccinated, you significantly decrease chances of being admitted into ICU and also die. Just to conclude there on this one, on the statistics, Mr. Mzulu, people who are admitted with COVID infections now, 99% of them have not vaccinated. 1% are people who have vaccinated and are just getting a bit of a mild infection, but it also would not complicate. So there is really a reward and a benefit for coming forward and vaccinate.
Yeah. Interesting, Deputy Minister, that you raise those stats, because a question from Bridget in Paarl coming through tonight on WhatsApp 072 110 5584 is asking particularly on a different kind of statistics. Among those who are counted dead on a daily basis, how many are vaccinated and how many have been killed by the side effects of vaccines? This is a question that many people ask, and they're saying government in particular is evasive on giving answers. There's no transparency around this particular statistic.
It will not be possible to be very explicit on that one, because there's a team of experts. It's a ministerial advisory committee on adverse events around vaccination. Yes, if I do vaccinate, we expect some, and the commonest of those symptoms is mild headaches, dizziness, nausea, and itchiness at the site of an injection. We also have documented ones, those that are actually related to heart problems, chest and respiratory problems, but I would not be able to quantify. That would be something that maybe Mr. Mdluli could also invite one of our experts who are advising the minister on adverse events. But out of so many people have actually been vaccinated, not so many people have had serious ones, but you can actually dissect it once you have the information before you. It may as well happen that there was something that was already in the body and probably it was not reported or was not being treated, and therefore you get a vaccination. Yes, it could be related to a vaccine taken 3 days ago, but it could have been any other underlying condition that the person might have not disclosed or might not have been aware of.
Yeah. Now, according to early data, there is some countries already who are rolling out what is called a supplemental dose of the Pfizer vaccine, a booster shot. Now, with a variant mutation like the C12, I know it's probably still early with only 6 million of the population vaccinated to be talking of a supplemental dose. But is a conversation already happening around the possibility of a booster shot?
Mr. Mdluli, you can only do a booster once you've vaccinated everybody first dose first. So we are pushing you are right, the issues of a booster is an issue that is taking place, being discussed in Europe and other parts of the country, of the world where they've done this. So for us to get to a booster is something somewhere around July next year, when we actually think we need it, because we'll be advised to say, at what stage we do need that to boost, if we do, after we have been completely vaccinated. And number two, the issue that we are raising about the new variant, our experts are saying not to worry for now. We'll monitor it and see how vicious it is, what type of a variant is this, how is it related to the Delta one. So that also is kept there. Someone was actually saying we do have experts in the country who are monitoring, and they will actually advise appropriately what to do. But for now, we are focusing on vaccination, massive vaccination of all South Africans, hopefully to get this 39 million from age 18 and above by end of this year. Then we can be able to say, is it necessary to have a booster? Yes, when? July, August next year. But let's first push the vaccinations first.
I know you are saying the debate is still ongoing about vaccine passport in the country. However, it is more advanced in other parts of the world. Are we likely to see ourselves, for example, unable to travel to Germany because the Prime Minister there is very clear around his position on vaccine passports?
Mr. Mdluli, don't ask me things that I was not aware of. I mean, there's a discussion going on between Minister Phaahla and Minister Motsoaledi, who's also a minister related to issues of home affairs and issues related to travel, entry out of the country and in and out. So that part is another discussion that I have not really heard the outcomes thereof. But yes, we will probably not disadvantage South Africans to travel for business or leisure because there are certain things that have not been done in our country. What I could actually caution now, Mr. Mdluli, which probably you are aware of, is people who are issuing fictitious certificates, and that we really detest, and we have to advise people. Some people have already been arrested. Don't do that, because otherwise one day will be arrested. So now there's a process. Yes, we know there are certain stringent regulations by other countries, but that's a matter that is being discussed, how to turn it around, because no South African should be disadvantaged to actually be
conducting business internationally or going out for leisure. Dhlomo, I appreciate your time. Thank you very much for joining us. Deputy Health Minister, Dr. Sibongiseni, Dhlomo, outlining some of the strategies and tactics being taken by the department to increase vaccine coverage in the country.